everyone, welcome to your interview day here at McGovern Medical School, UT Health. My name is Camila Calderon. I'm one of the PGY2s here in the Department of Emergency Medicine, and I'm excited to have you take a look around, even though it's virtually. I'm outside Memorial Hermann right now, which is one of our primary sites where we train. It's where we get all the action, and we are in the Texas Medical Center, which is one of the biggest medical centers in the entire world. When you're here in the hospital, you can feel the vibrant energy. There's world-renowned research centers, hospitals, 2 medical schools, nursing schools, everything you could possibly want, but all inside the small family feel that is our residency program. So I'm excited to have you come and take a virtual look, and please come with me inside. Memorial Hermann's brand new 17-story Seraphim Pavilion is part of a $700 million renovation and home to our brand new emergency department. We currently have 44 beds, including 12 resuscitation bays, and we are still under construction, which will add an additional 27 rooms by 2021. Our ED has over 80,000 visits a year and about a 40% admission rate. As the only combined adult and pediatric level 1 trauma hospitals in Southeast Texas and a center for STEMIs, strokes, adult burn, hyperbaric, LVAD, and all organ transplants, we see some of the sickest patients, which is exactly what you need to leave our program as an excellent emergency physician. Our ED is divided into 2 pods, trauma and medicine, each staffed by 2 residents and 1 attending. We also have a swing resident, which flexes to help either pod during peak hours. We have an amazing relationship with trauma surgery and work with them hand in hand. We take the airway and primary survey for all level 1s, and trauma surgery does the secondary. Together, we get procedures done. There are plenty of procedures, so no need to worry there. We have teaching bins in all the pods for downtime learning. Our Peds ED sees about 18,000 patients a year. We are exposed to some of the sickest kiddos and get exceptional training with every congenital and genetic disease you could think of. We have a dedicated month for Peds ED, our intern year, and we get Peds shifts during our ED months all 3 years, all year round. So you're constantly seeing kids up until graduation. Our PEM faculty and PEM fellows are amazing to work with. Given that we train at the busiest level 1 trauma center, we are lucky to be one of the only hospital as a level 1 trauma center in Houston that has a helipad. Our helipad transfer team is none other than Life Flight Air Ambulance Program, started by Dr. Red Duke in 1976. It was the first helicopter air ambulance in Texas. It is the busiest civilian helipad in the U.S. with approximately 3,000 missions a year. They operate 6 EC-145s at 5 bases, covering a 150-mile radius. Right behind Memorial Hermann, we have the library, where our ED offices are located, and McGovern Medical School, where we have state-of-the-art simulation and procedure lab. Here we do rare procedure and advanced airway labs throughout the year. Come take a look. As part of conference once a month, we have simulation where we prepare for high acuity patients, both adult and pediatric. Your first month as an intern, you will have plenty of practice with procedures, including a cadaver lab, so you're ready to perform your first lateral canthotomy or your first transvenous pacer, your first month of an intern. This was the case with one of our interns this year, and I performed my first lateral canthotomy my very first week as an intern. We are fortunate to train in a program that has such high acuity that our, quote, rare procedures really aren't that rare for us. And we have such amazing faculty that you will be prepared for anything at any time. They even take time out of their busy schedules to go over procedures with you if you ever want extra practice. Next, we'll go visit LBJ. LBJ is our other main training site and one of 2 county hospitals in Houston. It is the busiest ED in terms of volume in the city. It is located in Northeast Houston, about a 15 to 20 minute drive from the medical center. Here, we see some of the most underserved and sick patients, mostly Hispanic and African Americans, who live in neighborhoods that have some of the worst healthcare indicators and disparities in the state. It is a level 3 trauma center. The acuity is high, and again, plenty of procedures. Here, we learn how to transfer for a higher level of care, which is super important for your future training. And we are exposed to a very diverse patient population. LBJ has 4 main pods, and we staff 2 of them, the critical care pod and gold pod. Critical care is where you grow the most as a second year. You staff that pod with an attending, and we do have an intern that flexes over during peak hours. LBJ is where you will grow the most. You will see very sick patients.
Thank you so much for being here with us today.
Can't wait to see you.
Best of luck on the interview trail.